Welcome back. Continuing our talk earlier, the number of Americans with diabetes is expected to double or even triple by 2050, from 1 in every 10 today to as many as 1 in every 3. Caring for people with diabetes eats up 11% of the total global health care cost, nearly $400 billion a year. Joining me now in a CNBC exclusive is Eli Lilly, Chairman and CEO John Lechleiter, who is at the Cleveland Clinic's Innovation Summit, and he has some ideas on how to defuse this health and economic time bomb. John, good to have you back on the program. Welcome.
Thanks, Maria. Nice to be here.
First, I want to ask you about the Cleveland Clinic's Innovation Summit. I love that summit, and I'm sorry to have missed it this year. What's the buzz coming out of the summit? You're with healthcare venture capital people as well as doctors and healthcare professionals.
Well, it's a great conference, and I'm pleased to be able to be here. I think we're sort of alternating between looking at diabetes, obesity, metabolic disease. Obviously, cardiovascular disease is in there as well. I think diabetes, unfortunately, sort of has tentacles that reaches out way beyond the initial diagnosis. And of course, left unchecked, diabetes can cause some very, very serious complications in the course of the disease that obviously companies like Lilly are working hard to try to prevent.
I want to talk to you about that. 285 million people worldwide have diabetes, a number expected to grow to 439 million by 2030. How is this global diabetes epidemic a challenge and an opportunity for your company?
Well, it's a challenge just because of the sheer growth in the numbers. The prevalence of diabetes, the growing prevalence is nothing short of staggering. Obviously, it's a problem here in this country and in a number of other developed countries, but Maria, it's becoming an even bigger problem in places like China, Pakistan, and Indonesia. I think we're also learning that diabetes is maybe a little different across different populations. To that end, we were pleased yesterday to announce the opening of a new research center in China to study diabetes at a very basic level and hopefully help us understand whether there are aspects of the disease that are unique to that population.
Why did you choose China to open up this diabetes research center?
I think several reasons. First of all, China has a huge public health issue prompted by the fact that diabetes is spreading very rapidly in China today. We know it's an area of concern for the government. Secondly, it's a key area of expertise for Lilly. We have a long history in diabetes. Finally, it gives us access to some of the most talented researchers in the world, people we hope to recruit and have work for us in Shanghai.
Yeah, I think it's interesting that the center will employ mainly scientists from China. The scientists can't get into the United States due to green card limitations. Is that right?
Well, a number of the scientists we recruit to work here in this country from American universities happen to be Chinese or to come originally from China. I think opening this research center gives us the opportunity to employ those scientists here in the U.S. Or in China. Obviously, a number of those folks will stay here, over a period of time that they may choose to work in either place.
That is terrific. That's really interesting, John. Now, last month you learned that your novel once-weekly diabetes drug by Durian was rejected by the FDA. So do we have an FDA that encourages innovation? Do we have the appropriate balance of safety and innovation? And when are we going to find a cure?
One of the things I talked about today, Maria, here at the Cleveland Clinic is the need I believe we have to take a more sophisticated approach to analyzing benefits on the one hand and risks on the other hand. This is something the industry believes that we need, and I think it's something the FDA believes we need as well, and they're talking about doing this in a recent proposal that came forth from the FDA on regulatory science. Obviously, we're disappointed in the outcome by Durian, but we're working hard, Lilly and Amylin together, to address the questions raised by the FDA. We hope to get that resolved as soon as possible.
We're all looking at, hopes for stopping caring for disease and instead preventing disease or curing disease. Give me your sense of healthcare reform and how it impacts those efforts.
I think health care reform, by virtue of giving more people better access to health care, should make a difference in helping us prevent certain diseases. Obviously, opportunities to gain cures are fairly rare. We all seek that, but I think today our best strategy in diseases like mental illness, diabetes, and cancer is to first of all prevent, and then try to come up with better interventions that at least minimize the progression of the disease, the discomfort for the patient, or slow down its ultimate consequences.
Is there a big impact, in your view, from the midterm election victory on the GOP side last night to Obamacare? Tell me how you see this playing out.
I think, Maria, first of all, it's very early, obviously, in the after hours of the election. I expect that the main elements of health care reform as they affect our industry are going to remain in place. There are some things that I think will be called into question. We said when the legislation passed that wasn't perfect by any means. I expect there's going to be a healthy debate in the Congress, between the Congress and the White House. Clearly, what we need in our business is a sense of certainty that at least enables us to plan going forward. For right now, we're going to plan on the basis of what the health care reforms dictate.
Would you like to see the implementation slowed down a bit?
Well, I think, health care reform as it was passed is on an implementation timetable, in some cases over about a 10-year period before some provisions kick in. I think we must accept that there has to be health care reform at some level. In other words, I don't think this is a debate between, do you like the health care reform legislation on the one hand, or do you want to go back to the status quo? I don't think there's ever going to be a status quo when it comes to health care, because of the growing needs brought on by an aging population, the demands on the system, and some fundamental questions about who pays for what. We're going to have to wrestle with these as a country for years to come.
All right, we will leave it there. Good to have you on the program, John. We'll be watching your progress. Thanks for joining us.
Thanks, Maria.
We'll see you soon. John Lechleiter joining us.